Now, an aid conference for Gaza took place in the French capital. French President Emmanuel Macron played host as he reiterated Israel's right to defend itself. The UN's Under-Secretary General for Humanitarian Affairs, as well as the Commissioner General for the UN's Agency for Palestinian Refugees, spoke about the urgent need of a ceasefire in Gaza.
The situation is very simply put, it is insupportable. And to allow it to continue would be a travesty. Civilians must be protected, their essential needs met wherever they are and wherever they decide to be. The United Nations cannot be part of a unilateral proposal to push hundreds of thousands of desperate civilians in Gaza into so-called safe zones. We cannot be part of this.
The volume of aid coming in through Rafah blatantly is inadequate. All crossings should be open, in particular crossing points with Israel like Kerem Shalom. But humanitarian aid alone will not cover the needs of people in Gaza. It must be complemented by the private sector and the restoration of municipal services like water and waste management.
We can now bring in Lucile Marbeau, spokesperson for the International Committee of the Red Cross based here in Paris. Good afternoon. Thank you very much for joining us here on France 24 today. Your reaction to Paris playing host to this conference without issuing calls for a ceasefire so far?
Listen, what's important today is indeed for there to at least be some diplomatic weight, which is put in order to ensure a better respect for international humanitarian law. And these are few things. It's, of course, massive assistance, which needs to finally get in to Gaza because the needs are just absolutely staggering. And, of course, also the protection of civilians, mostly also in the north of Gaza, where there are still who are remaining. There's people in hospitals. And to come back to your initial question, of course, us humanitarian organizations, we need to be able to operate in a safe humanitarian environment. And for that, of course, we do need some pause in hostilities. Just to give really a speaking example is last Tuesday, we had a convoy of ICRC trucks and 2 cars, which was hit during hostilities. 2 trucks were destroyed, which had medical assistance in them. And we also had a driver, a colleague, who was injured and wounded. The colleagues proceeded in the mission to go all the way to Al-Shifa to be able to give that much needed medical assistance and then evacuate some heavily wounded people to Rafah. But this shows to which point today it's dangerous for us organizations to operate and to be able to access those who are in the most blatant need. And just to remind, there are still civilians in northern Gaza. We have seen, of course, many people evacuating and leaving and who are going to find themselves in dire situation also in the south. But there's also all those who remain in the north. And this civilian population must be assisted and they must be spared also by the current hostilities. And this is also one of our calls.
Lucy, very briefly, if you could tell me who was the source of that fire? Do we know who was the source of that fire, who fired on the Red Cross's convoy just the other day?
I do not have that information, but of course, each time there's this kind of event on medical, any humanitarian convoy or medical also transportation, medical health workers, our message is always clear, and it's to all parties, of course, to the conflict, is that they must not target humanitarian aid workers, as they must not target, of course, healthcare facilities, as well as healthcare volunteer aiders who are trying to reach people under the rumble and trying to save basically lives.
Lucy, talk us through what is going on there on the ground, because of course we as journalists are reporting what is going on. We see people moving, we see the destruction, we see the suffering, but what are your teams on the ground faced with in terms of medical help they have to give people there without supplies, without pain medication, without electricity?
Our chief surgeon doctor, who is based currently with a whole surgical team in the European hospital in Gaza, told to which point they're absolutely overwhelmed. And this surgeon, he has already been in Gaza in the past, and he was saying that he had never seen such influx of wounded and of severe wounds, which now he fears will not be able to treat because medication is starting to lack. And that's why our calls are really for this massive humanitarian help to be able to finally get in and alleviate all the needs, which are staggering. And all the humanitarian organizations, of course, which there's the International Committee of the Red Cross working with our partners from the Palestinian Red Crescent, we cannot respond concretely to all those needs. So, and the needs are really multiple. There's, of course, access to food, to clean water. There's no basic shelter for lots of the displaced persons who are sleeping. Families are sleeping outside. There's the access, of course, to medical care. And the more you go north in Gaza, the more the needs are huge, and also our access is restricted. So we really need this humanitarian access to be guaranteed in order to operate. And this is also one of the obligation, of course, of the different parties. And also our priority list, I'd say, fortunately, is very long. We have a constant dialogue with all the parties to the conflict regarding their obligations. Their obligations are, of course, to protect civilians in hostilities. And when we talk about the civilians, it's the whole population of Gaza. It's also, of course, the hostages who we're calling for their release, or at least to be able to visit them the time they are still being retained. But there's also this safe humanitarian access, which today is absolutely vital, and the respect for medical care, medical infrastructure, but also transportation, which we have not been seeing enough. And the situation is really getting more desperate every day.
Lucy, we of course have seen the needs for medical attention now. Of course, we have people who have been injured in blasts and strikes, what have you. So we know those needs, but what are the risks down the line, given that, as you said, people don't have access to proper sanitation facilities, they're sleeping outside? I heard someone say that there were 2 toilets for some 50,000 people. So clearly, there's a bucket load of things to come.
I have to say that it's terrible to which point we have all humanitarian organizations present in the field and trying and seeing all this suffering, how we have been repeating ourselves since now weeks. One of the disasters that we are seeing coming, and we keep on warning of, is the development of health issues linked to access to the non-access to safe water, to clean water. So it's certain diseases which can be developed, hepatitis. There's many other things that people now can really fall sick of. Children can just die of diarrhea. And we know that the majority of the population in Gaza is under 18. And little children under 5 can just die from, as I was saying, diarrhea. And so there's, of course, cholera. There's many aspects here that we have been warning about. And that one of the solutions is to finally solve the fact that there's a lack of electricity. If at some point we were able to put back vital infrastructure, electrical infrastructure, and be able, for instance, to have the desalination plants again resume and be able to give further access of water, that's one of the solutions that we have. So amid the call for assistance, there is, of course, also at some point we need to be able to fix the infrastructure, which is vital for the population, electricity and clean water.
The president of the ICRC was one of the people who spoke at this aid conference organized today. Do you think that it was great for them, for your organization, to be in the same room as some of the decision makers, not in this conflict, but on the global stage, like Emmanuel Macron, like Ursula von der Leyen, to speak in the same room and look them in the eye and tell them what your organization needs?
It is, of course, important for the ICRC to be present in this type of conference where some decisions which could alleviate the suffering and help us do our work basically have some impact. But just to say, this is something which has been shown publicly, but there's all the work that we do behind the scenes and behind the closed doors with all the states who could have an influence on the parties and on the humanitarian situation. What we do then also is to recall to those states and all those who can have an influence, other actors who can have an influence, of their responsibility regarding the humanitarian situation, which is getting catastrophic just days after days. And it's important to remind that within the Geneva Conventions, the first article, which is common to the 4 Geneva Conventions, says that states have to respect, of course, the Geneva Conventions, but also ensure respect. So they also have a role when such type of humanitarian crises are unfolding to really play their role in guaranteeing that international humanitarian law is being further respected than it is today.
Lucile, we're going to have to leave it there, unfortunately. Thank you very much for joining us on the program today. That was Lucile Marbeau, spokesperson for the International Committee of the Red Cross based here in Paris.